a lot of people are very shocked when they hear that fatty liver can cause liver cancer. I was just talking to one of my sisters the other day and I mentioned this to her and she was like, what? Fatty liver can cause cancer, And that is the reaction from a lot of people. Now, I admit that years ago, whenever I saw fatty liver, I just kind of brushed it off. I said, oh, I'm just a little fat in the liver, right? And they really didn't focus too much on it, didn't really give any education to the affected patients, right? But now I know much different. And actually, it is very obvious now that fatty liver is the cause of a lot of liver failure in this day and age. And in fact, it's one of the top causes of people needing liver transplants. And I believe it's actually the top reason for children to need liver transplants in North America, right? So what is it about fatty liver? Like, how on earth can simple fat deposits in liver lead to liver cancer, right? And that's what we're going to address in this video, okay? And I'm going to try and keep it really, really simple, right? So what happens, right? Well, fatty liver can be caused by different things, right? The commonest decades ago was alcohol. Alcohol-induced fatty liver disease, right? Certain medications can cause fatty liver, but now the commonest cause of fatty liver is, well, let's say insulin resistance, or basically conditions where there is too much sugar, too much glucose in the body, and that glucose has to be stored somewhere. And what happens is that it gets stored as fat all over the body, but especially in the liver, because the liver is the one that big metabolizers of sugar, of glucose, right? And so that is how fat gets in the liver, either from alcohol, different medications, or just having excess sugar in the diet. And so you have the liver cells getting more and more fat deposits, right? And they become swollen with fat, okay? And in fact, if you look on a biopsy sample, they'll talk about globus distension of the liver cells. They're just like fatty balls, and so most of the actual liver, cell is replaced by fat. And so you have the cells getting more and more swollen with fat, and eventually that swelling, that distension of the liver cells causes inflammation. Like overall, there becomes some inflammation. Liver just gets inflamed because it's very stressful having this excess of fat in the liver, right? Almost a foreign substance, right? But in excess. And so it's stressing the liver. It's not able to carry out its normal functions, eliminate toxins from the body and so on. And so ultimately it starts getting inflamed, right? Now, you have the first stage, which is just fatty deposits, right? There's no inflammation in the early stages. And then eventually when it just continues more and more, right? More distended, more stress, then you get low level inflammation, mild inflammation, right? And what is inflammation? Think of a pimple. You have a pimple on the face or whatever, and it gets a little red. That's inflammation. The body's trying to sort of fight, germs and so on. And in the process of fighting off those germs, right, it sets up this inflammatory response, which is obvious, with the pimple as a pink, reddish area. And then there's also pain and swelling, right? Those are signs of inflammation, right? Visible to your eye. Now picture that in the liver, right? Some stress to the liver, and then it gets a little inflamed. The inflammation starts very mildly, mild inflammation. But then the stress continues. You continue to store more fat in the liver because there's no change to the diet, right? And so the inflammation gets worse. And slowly over time, these are things that happen over months, years, okay? And slowly the inflammation continues and it gets more and more severe. And then you can actually start having some discomfort in the liver, right? Because the inflammation is getting worse, right? So before the inflammation, it's just the fatty deposits, and it can just be simply an enlarged liver, right? Most people have no symptoms with that. The doctor might actually feel an enlarged liver, or incidentally, it might be found on an ultrasound or some other sort of study that is done, right? So enlarged liver, then it starts to get inflamed. You might or might not have any discomfort or pain, right? But the inflammation is going on slowly over time. And then what happens, right, is that once the inflammation continues, what happens is that scar tissue starts to form. So think again of a cut. You have a cut on your skin and there's inflammation as it's trying to repair itself, that you have that redness, oozing of that, fluid, all the inflammation. And then finally, the cut starts healing. And then depending on how deep the cut was, it might heal with a scar. So that same scar tissue is forming in the liver, okay? And we call that fibrosis. So all that inflammation, and then you have healing, like it gets inflamed, then it heals and inflames and heals. And so with every bout of healing, every little healing, then you get little scars forming. Fibrosis gets fibrous, right? And as that goes on and on and on, right, you have areas of healing, then you have some regenerated. The liver kind of tries to recover because our body has an amazing ability to sort of regenerate, right? So you have areas of regeneration, but then there's still scarring that kind of pulls it in. So you have this sort of these nodules where you have regeneration, then you have the fibrosis, the scar tissue, and then that goes on again, a long process. This can take years, right? And so with all this scar tissue and fibrosis, then you can go on now to have cirrhosis, right? Which is basically scarring, extensive scarring of the liver. So a lot of the normal liver tissue is replaced by scar tissue. And of course, the scar tissue is just scar tissue. It has no use like the liver cells. So there's no function, there's no cleaning of the blood, there's, no helping to metabolize all the different substances, right? It's just scar tissue. And eventually you can have the liver actually getting shrunken, right? Because of all the scar tissue and loss of normal liver cells, right? But there's still a bit of inflammation going on. And so what happens with the body is that over a period, like when you have this chronic nagging trauma and inflammation, right? Because the cells are trying to regenerate, okay? Eventually a mistake can happen. And that's where now the cell can transform to a cancer cell. And then you can get cancer. Now, this process can take years, right? It varies. Like for some people, it can take decades. For some people, a few years. But we're seeing more and more cases of young people in their 30s and 40s with liver cancer. And then a lot of these people, they actually started having fat deposits in their liver when they were teenagers, early puberty. So they had 2, 3, 1, 2, 3 decades now. By the time they're in their late 30s to 40s, they would have had fatty liver for maybe up to 30 years or more, right? And so with that, and then ongoing chronic low-level silent inflammation, and then the scar tissue forming, right? You have the cirrhosis, and then again, abnormal, just kind of chronic inflammation, and then eventually you can have cancer cells forming, right? Cancer cells tend to form where you have repeated division of cells, right? Or regeneration, division, multiplication, right? There's more likely to be a mistake, right? Because it keeps having to change and regenerate, repair. And so mistakes can happen, and the liver is already not normal. So that's how you can have cancer forming, right? So that's kind of how that the process from normal liver to liver cancer. I forget the actual percentage, right, of people with cirrhosis who can go on to get liver cancer, but it's not a tiny percentage. It's actually a significant percentage, right? But it's still way less than 30%. I think it's 20%. Don't quote me, but basically it's when you now start having the fibrosis and the cirrhosis that the chance of cancer can set in, right? What to do? Essentially, if you ever get a diagnosis of fatty liver, take it seriously. Don't brush it off. Don't do like what I did back in the day, and say, oh, it's just a little fat in the liver. And most people feel that way. Oh, it's just a little fat in the liver. It's not just a little fat in the liver. It's a substance that is causing congestion in the liver. It's causing stress to the liver. And then it's resulting in inflammation of the liver. Liver is not functioning properly and causing the scar tissue. It's not just fat. Take it seriously. In the early stages, adjusting the diet can help certainly halt, if not slightly reverse some of those fatty deposits, okay? Because at the end of the day, the fatty deposits are there for times of need, times of starvation, okay? So if you alter your diet in a way to where you're not having as much of the sugar that needs to be stored, right? You will eventually be able to resorb, right? Metabolize some of those stores and reduce the amount of fatty deposits in the liver, right? So I hope you all found this video helpful. The message is take fatty liver seriously, even if it's mild. Don't wait until 5-10 years from now to find out, oh my goodness, there's liver cancer. I need a liver transplant, okay? take it seriously. Thank you for watching. Any questions, let me know, and you can check the description below for some resources that I have, including some that may be able to help you if you actually find yourself with fatty liver. Enjoy the rest of your evening.